Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
1991, my father, who you know I adored, we just lost him a year and a half ago, we brought him to Dr. Lederman. You need to bring yourself or someone you know who needs to have the barnacles scraped off their backside to get their rear in gear and walk in there right now because Dr. Gil Lederman is New York's only triple board certified Harvard-trained radiation oncologist, first brought the non-invasive stereotactic body radiosurgery to America, and he's got the longest experience treating cancer using radiosurgery. So look, do yourself a favor. If it's cancer-related, and I'm talking breast, lung, pancreas, liver, kidney cancers, and more, you got to bring it to Dr. Gil Lederman. He'll send you an informative booklet DVD. You watch it first, you read, you sit down one-on-one with Doc Lederman, and then you prepare for what it is you want to do and you should be doing. Just call Dr. Gil Lederman at 212-CHOICES. Set up that appointment today, 212-CHOICES, or set it up for someone you know won't do it for themselves. At 212-CHOICES, that's 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD. New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. It's Gil Lederman. I'm here with Russ in the control panel. We are live, so you're welcome to respond or call. And I have a lot of patients and others who are listening, and I know they want to ask questions, but they're afraid to. We don't bite. We don't chew. We don't even nibble. So if you want to call us, we're at 1-800-848-9222. That's the WABC studio line. We're here very close to our own office. Our office is at 38th and Broadway, which people ask about all the time. What's your address? 1384 Broadway. The phone number for ABC studio is 1-800-848-9222. Call Russ. We'll speak and answer your questions if you have any. Again, it's Dr. Lederman. We're here to talk about cases and try to learn from other people. If you can learn from other people, then you don't maybe have to suffer so much yourself. And that's kind of how I was raised and grew up and what my parents taught me and how I live. And let's learn from others and let's learn from the data, because there's been thousands of patients, sometimes hundreds of thousands of patients studied and analyzed, maybe with the same condition you have or your loved one has or your neighbor has. And if you can learn from them, it's a lot better than repeating mistakes. So the first case I want to talk about today was a very interesting young woman. She came to me in October last year, actually 2 years ago, 2012. She was 39 years old, and at that time she had a history of breast cancer at age 31. So, wow, 31. She was born in the Dominican Republic, has been here years, is a very lively, spry, wonderful woman. So she had breast cancer in one breast, and she chose to have bilateral mastectomies, which I, of course, don't advocate because there's no data for it. But we could talk about that another day. Anyway, she was on treatment. After surgery, she had chemo, and then she had years, actually, of chemo at the most famous hospitals in New York. And she came to me, and at first I saw her, and I said, look, I don't think you need any treatment from us. And she did fine. And recently she came to us. She did need treatment. The cancer spread to the brain, and we obviously offer fancy treatment. We were the first in New York with fractionated brain radiosurgery, which is a non-invasive technology that allows us to focus in and hit the cancer and not hurt the healthy brain. She went to Florida for a week and came back, and she said she was so tired. She couldn't stay awake. She's sleeping all the time. And she saw all her doctors, and no one knew what to do. And she was so sleepy and so tired. And I said, well, let's get a blood test. And she said, I already had it done. And I said, well, let me get a blood test. Give me a chance. Let me get one blood test, and we'll see what's going on. And we got a blood test, and sure enough, she had elevation of her calcium. Now, elevation of cancer patients' calcium often is related to the cancer. Sometimes it's caused from the cancer eating through the bones. Sometimes it's caused by the cancer making a protein that causes the calcium to be abnormally elevated. But whatever the cause, voila, as we say in France, she had high calcium, low protein, which is a bad combination because it means there's a lot of calcium in the bloodstream, too much, and it can suppress people's neurologic system. This is on Wednesday this week. We got her treated, and by Thursday she looked like a new woman, and she walked in my department and she said, wow, you're so smart. And I said, no, I'm not so smart. I just did the right thing. She said, but you got it, and all the other doctors missed it. And I said, well, I've been at this a long time. Yes, we were able to diagnose the problem, treat her, wake her up so she could live her normal life. Wow, she is so happy. She runs a cancer support group, and maybe she's listening. Maybe she'll call us. But that's what it's about, to see the doctor. At our facility, Radiosurgery New York, you get to see the doctor. You don't speak to the secretary or the answering machine or a student. You see the doctor, and what a difference it makes. So when they're talking about cutbacks, and you're not going to see this, and you're not going to see that, and you're not going to see the next guy, it does make a difference who you see and how he's trained and the relationship with the patient and how he knows the patient and how the patient knows the doctor. So this is a simple case, knowing the patient, getting the right test, and treating her. So she woke up. It's good news department for her. It's good news department for everybody. And maybe a listener out there who's suffering similarly as this woman, we can wake her up too, or wake him up, and get them back on track, feeling better, having a productive, good, healthy life. And in the good news department, wow, there's a lot of good news department here. So with a gentleman, this is a 56-year-old man. He was here with his girlfriend and his daughter for consultation. He had metastatic colon cancer. He was diagnosed in 2006. He had rectal bleeding. He had rectal bleeding for 4 years, and he was told by nurses and doctors and that he had hemorrhoids. No one looked. Nobody looked. How can you tell someone they have hemorrhoids when no one looked? It's not right. It's a guess, and it's a stupid guess. And it caused this man a 4-year wait, unnecessary wait. He finally had colonoscopy. They could not even do colonoscopy because the bowel was obstructed. By then he had severe bleeding and narrowing of his stools. He underwent emergency surgery to remove the primary. And unfortunately, the liver was already affected by metastasis. So in those 4 years when he was told it's hemorrhoids, the cancer was growing and spread to the liver. Anyway, he started on chemotherapy, and he did okay. He did okay for 6 years. And then the cancer started relapsing in 2012, and the surgeon went in to cut out where it relapsed. In 2013, the surgeon cut out again where it relapsed. November 2013, cut out again. By this time, he's tired of wrong news, chemo, surgery, and when he came to us in January this year, he had 3 spots of colon cancer, metastatic, and he was fed up with surgery, fed up with chemo, fed up with bad information. He heard about radiosurgery. I met with him. He had 3 separate spots. We treated those 3 spots last winter. Radiosurgery, it's pinpoint treatment. We send in beams just to hit the cancer. He had that treatment. 2 areas we treated at once, so we got 2 for 1, half price sale. And he came back this week with a new PET scan. We like to not only treat the patient, but also follow the patient to be able to tell the patient, did it work or not work? Everyone wants to know, did your treatment work? Did my treatment work? For the patient, it's my treatment. It's a personal matter. It's very personal. This man's 56. He has a girlfriend. He has a daughter from his marriage. He works. And he's in the good news department. Why? All 3 spots of cancer went away with our non-invasive focused beam stereotactic radiosurgery, a non-invasive treatment that we pioneered. We were the first in America, and I certainly believe in it. I wouldn't be here if I didn't believe in it. And we have this gentleman who's standing proof once again. And colon cancer is one of the more resistant cancers. Nevertheless, when we focus the beam on the cancer, dial up the dose, hit the cancer, not hurt the healthy tissues, voila. Voila, great news. He had no side effects. He continued to work, have a normal social life, a normal sexual life, and he's in remission. No new cancer, all 3 spots gone. And that's what we like to do. And because of the effectiveness of radiosurgery, where we focus the treatment, that's often the news. Most commonly, that's our news. So for him, good news. The first case, diagnosing the patient properly, treating her. Second case, treating this gentleman when he was just tired of surgery, which wasn't working, and chemo, which was just seeming like spreading the cancer, not treating the cancer. So with us, there's no spreading because we don't touch the cancer. Isn't that what you want? No one else's hands in your body? I think so. So we're going to have a little word from some new voices that are going to talk about work that we do for treatment of prostate cancers and body cancers. We're live. This is Dr. Lederman at the WABC studios. We're taking your calls, so feel free to call us at 1-800-848-9222, 1-800-848-9222. We have a booklet and a DVD to send to people about our work if you want. We have separate booklets about prostate cancer, body cancers, and brain cancers. So don't be shy. Give us a call, and we'll be back in just a moment after you hear from these enlightening, beautiful voices.
With Dr. Lederman, the best prostate cancer treatment is custom-tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With body radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second